Excellent.
I'm here with Dr. Kinzer this morning.
Good morning.
Did I pronounce it correctly?
You said it right, yes.
That a boy, that's what I want to hear. And we're going to be talking about sleep apnea. And, you know, I want to ask you a few questions, and I want you to get all your information out there because so many people suffer from this today.
Very common
And
disease.
that was one of my questions. Why this surge of people getting sleep apnea?
Good question. You know, sleep apnea, we feel, is probably one of the most underdiagnosed diseases out there.
Mm-hmm.
And so by creating awareness, all of a sudden now people are starting to ask questions, ask their physicians, ask their dentists even now.
Mm-hmm.
Because it's odd. You wonder, why is the dentist treating sleep apnea?
Well, a lot of it has to do with the facial and the breathing and all of that.
You bet. Yes, definitely.
I'll be darned. Now, before I ask you about some of the signs, does it only hit older people, or can younger people suffer from?
Younger people can. It's more commonly in older patients, 60s and 70s. More men than women, but children too. Also, weight's a factor too. Unfortunately, the more weight we carry,
right,
then the more chances of having this sleep apnea.
Right. I also understand too that one of the ways to help control this and or to cure it is to try to get that weight off of you and
yes,
and eat earlier so you don't go to bed with a full stomach and different things affect it. Am I correct?
Yes. So weight's a factor. Also, how you sleep in bed. The more you're on your back, the more chances of having that obstruction in the back of the throat.
Mm-hmm. Well, I want you to tell the viewers what you have here because this is one step on helping.
Right. So before I talk about our appliances here, you know, to me, I like to explain what's happening
Absolutely.
when you have obstructive sleep apnea. Again, it's probably one of the more common causes of sleep disorder. Okay, mm-hmm. There's other types of sleep disorder, but obstruction is one of the most common. And what we're seeing is that when a patient's relaxing at night while they're sleeping, their tongue is relaxing and collapsing in the back of their throat. And then they stop breathing. They'll either slow down or they'll stop breathing. And so currently, physicians are treating their patients with what's called CPAP. It's very common.
Right.
You'll hear patients. And so what that does is that blows air into the airway through the nose and or mouth, and then open that area up so that area doesn't collapse. So some patients just don't tolerate that. They can't fit it on.
They don't like the apparatus.
The apparatus. They're claustrophobic. You have to carry it around.
Mm-hmm.
And so we started looking for alternatives. And so this is just an example of one appliance that we have. And so it's an upper and lower jaw that actually fits in their mouth. And what this does is this holds the lower jaw forward just a little bit and open a little bit,
which keeps there's no obstruction.
Right. So by doing that, what's happening is we're keeping the tongue from falling back and collapsing. And so by simply just having something that's more portable, easier to wear, they can wear this and then keep that from happening. Also, you were talking that you know someone that has snores, for instance, and this looks a lot like a snoring appliance.
Right.
So snoring's a little bit different than sleep apnea, but it's combined with it. A lot of times, most patients that have sleep apnea also do snore, but not all patients that snore have sleep apnea.
So what are some of the signs, doctor, that people should look for?
So snoring's number one. Okay. Diabetes there's a high correlation of diabetes along with this mm-hmm. disease. High blood pressure, mm-hmm. Higher pulse rates, weight's kind of a factor also. We look at neck size. When I'm screening patients for this, if a man has a neck size of 17 or greater, or if a female has a neck size of 16 or greater, mm-hmm. there's a high correlation that they may have this. Also gasping at night. You know, if you'll hear a spouse talking that their husband, I have to wake him up because I think he's dead. I think he hasn't.
You hear a lot of people say that.
And there's recorded cases where you'll have someone stop breathing for up to 3 minutes when we're doing tests.
Now, will your body automatically say breathe?
If your oxygen level gets so low, at some point your brain is going to say wake up, and this is why. Also, another symptom is exhaustion. So these patients are tired all day long, falling asleep driving.
Right.
And this is how a lot of this got started, is that there were patients that were in car accidents, and they were finding that because of the result of the accident, they were tired.
I worked with a young man in San Francisco, and he'd fall asleep at his desk. He would fall asleep if there was a red light and he was there too long. He'd go out like a light.
Put it in park. Yeah,
yeah, he would go right
Probably
out like
has
a
sleep
light.
apnea.
Yeah,
or
well,
some
they
sort of sleep disorder.
diagnosed that, and this was many, many years ago before anybody heard about it.
Yes.
So it's amazing how this how this comes on.
Definitely.
And there really is no age, but all these different factors come into it.
Yes.
Overweight and whatever.
Yes.
So they should they come and go to a dentist first and see what.
Not all dentists do treat for sleep disorder. Definitely talk to your physician. Okay, all your physicians are very aware of what sleep apnea is. They can also make a referral to a sleep clinic. At the hospital here, we've got a great sleep clinic. San Andreas, they have a sleep center there, and so only a physician that's a pulmonologist can make this diagnosis. As a dentist, I can't diagnose sleep apnea. Sure. I can only treat it.
So if anybody has any questions, call the doctor at 223-2712 and either make an appointment, go in and talk to him, and
we'll take care of it.
Get that taken care of. And he's also can talk to you about the apparatus. Thank you very much, doctor. I appreciate it.
Thanks for having me here.
It was great having you and learning about this. With that, we're going to go to Cam.